Thanks for tuning in. Let's talk. Welcome to the fourth episode. I'm your host, Elena Lau, CEO and real estate broker of Union Real Estate. On today's episode, I will be sharing with you the monthly graded Boston housing market update. And today I had the honor to have Dr. Liliana Gomez-Infante from GLAD Specialized Family Dentistry, who will be talking about the current environment with the dentistry during COVID-19.
Hi, Elena.
So let's dive into the housing market. In the single family environments for the last month, we have 875 homes sold, which compared to last year, there has been a decrease of about 34% decrease. And compared to the last month, it's about 2.34%. With an average days on the market of 39 days, compared to last year, it's a decrease of 13%. Compared to last month, it will be about 19%. With an average sale price of $848,000. The percentage is just very minimal compared to last year and also from last month. In terms of the median sale price, it is at $670,000. Which comes with an increase of about 6% from last year and a minimal increase of close to 1% over last month. So if you look at this chart, you can see the changes by week. So as you can see, in terms of the sold price, the prices has been maintaining pretty flat. In the condominium market, there has been 590 condominiums sold, which has been a decrease of close to 50% compared to last year and 22% compared to last month, with an average day of 43 days, a decrease of close to 5% over last year and a decrease of 10% compared to the last month, with an average sale price of $663,000. We're also seeing a decrease in pricing of about 12% compared to last year and a 10% over last month, with a median sale price of $586,000, which compared to last year is about a 1.5% decrease and a close to 3% compared to the last month. So overall, we are seeing the same trend. We are experiencing a shortage on inventory with a high demand that's increasing week by week. So today, I also want to share with you like the chart here, like with the condominium market, like for the sales price. You can see that the price has been having like its ups and downs, but overall it's maintaining a pretty flat, just like the single family market. And today I also want to share with you like the home buying process that I deliver to my clients. So in order to navigate this COVID-19, there has been some modification on how we deliver the home buying process. So what you should be expecting as a buyer is that we will schedule a virtual consultation, whether it is by phone or a video conference, to learn about your real estate goals. Once we know what you are looking for, we're gonna help you get your pre-approval letter, or if you are paying cash, we will need your proof of funds. It's very important for you to be prepared in order to purchase your home and set you for success in order to get your offer accepted. And with that, once we know what you are looking for, we're gonna help you with your home search. So we're gonna email you the property that match the criteria that you are looking as soon as it hits to the market. So say that you are interested in couple of property. So depending on your preference, right now we're doing live or virtual property tour following the COVID-19 protocols and safety procedures. And right now, you might see open houses, but these are now conducted by appointment. So you cannot just go into the open houses. You need to schedule an appointment. So it's very important that you are working with your buyer's agents in order to protect your best interest and also coordinate all these showings for you. Once you are ready to put an offer, everything is handled electronically, including the signature. So you will sign all the offer documentation from the comfort of your home. When your offer is accepted, we will go through the home inspection, should you decide to go with that. So home inspection can be done virtual. What that means is that the home inspector will go in person to the property, but you don't necessarily have to be present. And then the home inspector will walk you through the findings and email you the report and discuss any issues that may present. So once everything goes through, the appraisal will be either done with an in-person visit, exterior only, or desktop appraisals. Once everything's ready and then you are ready to close, closing can be handled in person or through video conferencing. And then once we're on record, you are a new homeowner. So you will receive the keys to your new home, whether we give it to you in person or drop it off to you. So right now it's everything very convenient and more so to keep in mind of the safety that we are providing to you for you and the family and everybody involved. So that's what I got for you today. So with that, I want to introduce Dr. Liliana Gomez-Infante, who has the DMD and a CAGS in Pediatric Dentistry, and she also owns her own dentistry office, GLAD Specialized Family Dentistry. As an experience, she has the dental degree from the Central University of Venezuela, and also she has been awarded with the Clinical Research Award in 2000, and she's also an active member of the American Dental Association, the Massachusetts Dental Society, and the Hispanic Dental Association. A lot that you have accomplished, Liliana.
Thank you, Elena.
Thank you. So I wanted to chat with you about how the dentistry industry has been coping or dealing with COVID-19. So I wanted you to share that with us today.
Thank you, Elena, for the invitation. Yes, certainly it's been this past almost 3 months has been with a lot of changes. Dental offices were recommended to close for non-urgent or elective procedures back in March 16. That was the last day that we saw patients in our office. Since then until now, we've been seeing only a strictly emergency, a patient with pain, an infection, bleeding, things like that. And those were the only procedures that we were doing until now. Last week, we started, all dental offices were given the green light to start bringing less emergency, so what is called the urgent treatment, meaning that a patient that has a treatment that not necessarily is like super urgent is something that if we wait, it can become, more of a problem. Mm-hmm. And hopefully in phase 2 is when we will start seeing all non-urgent care, cleanings and things that were not required to be seen right now. All the dental offices during these 2 months, we've been doing webinars and being instructed ourselves to what the procedures, what to do once we go back to see regular patients. And in our case, this is a plan that we have designed. Basically, what the patients will see is difference in terms of the appointment. We will start the appointment from the day before. The day before, we will call the patient, ask some pre-screening questions related to COVID-19. Then we will request that they bring a mask before they get into the office. And the check-in is not going to be at the front desk. It will be like a virtual check-in. And that will be what we are asking the patient is to call us from there once they are in the parking lot to let us know that they are in the office, that they are there, and then we can let them know if we are ready to see them. This is because we're trying to minimize the amount of people, the amount of in the office. We are scheduling enough time between patients so we can be ready for the next patient. So once you arrive to the office, we will do the temperature. We will check the temperature.
Okay.
And the recommendations are 100.4 is what we are. I mean, if that's up to what I mean, the temperature ideally is a person that would know, I mean, 97 degrees or something like that. Right. And we will go over again where the same question that we asked the day before over the phone. We will go over again, and we will provide hand sanitizer. Okay. Once all those protocols have followed before you come into the office, then you will be directed to the operatory where you're going to see the doctor or the hygienist, and then that's where the person will be instructed to take the mask off. The reason to allow less people in the office is to allow to the social distancing recommendation. So in that way, we don't have many people at once.
So my question is, like, you are limiting the number of people who can go into the clinic, but like say a family of 4, are you also limiting us to bring that many people?
We are. I mean, certainly there will be exceptions, of course, because we don't want a mom. I mean, in my case, I see kids. I am a pediatric dentist. Let's say a mom with a family of 4. I don't want to make her come 4 times to the office. So certainly there will be, but it will be one child at a time. And so she's welcome to bring the kids, but only the patient will be in the office, and then the other 3 will wait in the car with her. So it will depend on what will be much easier for the family. If they prefer to split in 2 groups, or if they want to come the whole, everybody at the same time. And
so like, with this new whole protocol that you are you having an extra level of cleansing or disinfecting the place?
Yes, and the second slide, it's about the way, it's a cartoon, the way that we are looking. I mean, patients are used to see us in protective equipment, meaning that we all wear masks, we wear gloves, we wear lab coats. That's the normal that all our patients have seen. But now we have included more like that little cartoon that has the hair cover, a face shield, and the gown is going to be disposable. So some of my little patients said that we look like astronauts, and I like that they are, that they are coming out with different, to be more comfortable in the dental environment. So yes, it will be something like, and we will change that personal protective equipment called PPE after every patient that we see. So everything is disposable because to prevent and to avoid the cross-contamination.
Understand. So like, since you are adding this extra layer of protection, I'm sure there is a cost associated with that. Is that cost being transferred to the patient?
I mean, that's a very controversial topic right now. Honestly, it will depend on the individual needs of the office, I will say. Certainly, yes, I mean, there are a lot of more things that we have included, but at the same time is to protect the staff, the patients, their families, us, our family. So it's most important is the health and to prevent to spread the virus. And but that will depend on the individual needs of each office.
I see. Okay. So since now we are talking about also the coronavirus, like you mentioned that you check for if there is any sign of fever, but are you doing testing for coronavirus?
Not yet. I mean, hopefully it's been in conversations and a lot of petitions that we have signed that it will be possible to have the test in the dental office, a rapid test. Right now, the only tests available are the tests to see if you have the virus or the test if you have to determine if you have the antibodies, meaning that you already have the virus and now your body is fighting the virus. Ideally, in an ideal world, certainly will be that dental offices could have a test that will tell you in minutes if the patient is positive or not. In that way, it will be easier to okay, we can wait to reschedule the patient to 15 days later or things like that. And right now, the only measurement that we have is the only way to know is with a questionnaire that includes questions that if a patient has a fever or anybody in the family has been in contact with a person that has been positive for COVID-19 and the temperature. That's the only things. But hopefully, yes, hopefully, ideally will be as more research is going that dental offices could have the opportunity to have the test in their own dental office.
Right. So how about other extra measurement that you are taking?
Yes. So this is called surgically clean air. Basically, it's like that little black device equipment that has different filters inside. So basically, one is called the HEPA filter that it will. I have here my little sheet is the HEPA filter removes 99.9% of particles that are the size of 0.1 micron, which is a typical size of a virus. Then it has a second layer, which is the activated carbon, and will remove the chemicals on the air. And then the last layer, basically, or the last thing, it has an ultraviolet light that also help destroy what is left. So certainly, and this is the UV light, that's the way that they work. They break the DNA of the microorganism, bacteria, virus, and then in that way it will destroy. All these precautions have been taken because the treatment that we do in dental offices has or develops a lot of aerosols, and aerosols can contain also the bacteria of the bacteria and the virus. So with these two extra protection that we have included as well, we can clean the air and the room will be ready for the next patient to come as it was the first patient in the morning.
Oh, that's good. Well, at least it makes me feel more comfortable as a mom that if we have to bring my kids to your office or any other clinical, that at least precautions are being taken care of, right? Because like you said, the top priority is health. And then it's really comforting to know that you are taking already the measurement to do that.
Thank you, Elena. Yeah, so we are very happy that as we have been calling patients, they are very eager and happy to come back to take care of their teeth.
Of course. So right now we're gonna open up questions to the audience. I'm gonna check in on Facebook to see if there's any questions there. So we have Charles saying good morning to us. Martin is here and say great information, Liliana. Thank you very much. Question to you. What if a patient is infected with COVID-19 but has a dental emergency? Will you serve him? If just what will be your protocol in that case?
We will. I mean, if a patient has a dental emergency, certainly we cannot say we'll see you when you are done. No, but we will schedule that patient alone. We will make the time to make the appointment that the patient is the only. I mean, besides the doctor is in the office. In that way, we can. I mean, we will have all the protection that is necessary, and we can minimize that it will be spread to other people. So certainly we will accommodate that patient in a way that I know that there is nobody else in the office.
Okay, that's good to know. He also has another question. If any of your dental assistant is infected, what is your protocol at your office?
Yes, so certainly what we are thinking is that dental assistant will be placed in quarantine. We will call the patients that were seen on that day, and we will tell them that there was a person infected at the office with the COVID-19, and then we'll refer them to check for any symptoms or any problems. And if they had, do not hesitate to go to contact your primary care physician or the CDC. We will have to be tested, the other personnel, and of course we will sanitize the whole office, and yes, that's basically what it is for now.
Okay, good to know. Well, he wanna give you a big hug and wanna thank you for your information that you are providing. I also have one more question. Besides kids, what other services do you offer at your practice?
Thank you. Yes, we have. We are 4 specialists working in GLAD. One is a specialist in prosthodontics, Dr. Gustavo Infante. He does regular restorative treatment and aesthetic. He sees the adults, and me, I see kids. We also have Dr. Hugo Campos. He's an orthodontist, so he sees kids and adults for ortho treatment. And we also have a periodontist that also, work in combination with Dr. Gustavo Infante, which is they go one-on-one, prosto and perio. So yes, we have 4 specialties that covers a lot along the family.
Okay, so you are just basically one-stop shop.
Exactly.
That's good, Liliana. Well, thank you so much for your time and also your knowledge. I know that you are a very busy person, so I really want to thank you so much for
Thank you for the invitation. It was a pleasure to, be talking to you about all these new changes that dental offices are facing.
Thanks.
Thank you.
So with that, I want to tell everybody that I appreciate your time for tuning in on today's show. We are here to provide information to you. This program is based to provide information and also knowledge during these difficult times. So if you have any questions, you can contact me on my contact information that is shown below. I also want to announce our next featured guest speaker. He is Michael Chase, the Managing Director of Northmark, who will be talking to us about commercial real estate lending and how the commercial field is dealing right now with COVID-19. With that, we were signing off. Thank you so much.